Good evening, everyone. Thank you so much for joining tonight. We'll just give another minute or two for some more folks to join, and then we'll go ahead and get started. All right, so I think we can go ahead and begin. So welcome everyone to tonight's webinar, which is hosted by the Multicultural AIDS Coalition and the Coalition Against Hepatitis for People of African Origin, also known as CHIPO at the Hepatitis B Foundation. My name is Beatrice Sovich, and I'm the Public Health Program Manager at the Hepatitis B Foundation and the manager of CHIPO. Thank you all so much for joining today. So we'll start off today with two quick questions for the audience. So each one is a poll question, and we will now share the first one is, we'd love to know how many of you have heard of NAIRHHA Day before. So I am going to launch the poll. So we have two questions actually. The first one is how many of you have heard of NAIRHHA Day? And the second is we would love to know if you know what NAIRHHA Day stands for. So we'll give just a few more seconds for everyone to complete the poll, and then we will go ahead and get started. Okay, so I think probably most people have filled it out. So it looks like a little over, most people know or have heard of NAIRHHA Day previously, which is great. And everyone knows that it stands for National African Immigrant and Refugee HIV and Hepatitis Awareness Day. So I'm so glad, and thank you so much for your interest in coming today to learn a little more about it. So just to give a little bit of background and history of the day for those who are less familiar. So NAIRHHA Day is celebrated annually on September 9th, and it was first created and observed by a group of activists in New York, Washington, D.C., and Boston in 2014. And it's been celebrated on the local level ever since then. The day is aimed at bringing national and local attention to the health issues of HIV, AIDS, and viral hepatitis in African immigrant and refugee communities in the US in a way that is culturally and linguistically appropriate, and by addressing some of the unique issues that African immigrants in the US face in accessing HIV and viral hepatitis prevention, diagnosis, and treatment, issues like stigma, limited access to healthcare services, language barriers, low acculturation, and social and economic marginalization. NAIRHHA Day works to raise awareness, education, and resources to empower communities to take charge of their own health and to dismantle stigma, and also provides a chance to encourage and advocate for policies and practices that promote healthy African immigrants, communities, families, and individuals. So the purpose of today's webinar is to highlight two very important milestones in the history of NAIRHHA Day, which have happened this year. So the first is that NAIRHHA Day is now recognized as an official HIV Awareness Day by the Department of Health and Human Services and is listed on HIV.gov. And we'll share that website or the link to that website in just a moment. The second achievement is that this year a resolution is being introduced in the United States House of Representatives to officially designate NAIRHHA Day as a federal health observance. These are two momentous achievements for the day, and we are really thrilled to be sharing them with all of you this evening. The resolution will be introduced tomorrow, and we'll share the press release as soon as it is available. So today we have an opportunity to hear some remarks from Congressman Hank Johnson, who is one of the leads of the NAIRHHA Day resolution in the House of Representatives and is the co-chair of the Hepatitis Caucus. And he will share a little bit about why NAIRHHA Day is important to him and what inspired him to co-sponsor this important resolution. We are then very excited to be joined by a diverse group of panelists who will share insights about the unique challenges faced by African immigrant and refugee communities in the US in accessing appropriate diagnosis and care for hepatitis B and HIV, and we'll reflect on the true significance of the day in terms of advancing the ultimate goals of HIV and hepatitis B elimination. So we're looking forward to a very robust discussion. Next slide, please. Thank you so much. So just a quick note to highlight the organizations, again, that have led the NAIRHHA Day initiative, which include the Multicultural AIDS Coalition and Africans for Improved Access in Boston, and CHIPO and the Hep B Foundation outside of Philadelphia. I'll speak a little more about each of these organizations shortly. Next slide, please. Thank you. So before we get started, just a quick note about Zoom webinars. So I just like to remind all participants that during the webinar today, all audience members are muted. We encourage you to use the chat feature to let us know who you are and where you're joining from. And if you have any technical challenges, please indicate your issue using the chat box and we will address it as soon as possible. And at any time during the presentation, if you have questions, you can feel free to enter them into the Q&A box, and questions will be addressed by the panelists at the conclusion of the discussion. The session is also being recorded, and the recording will be shared with attendees following the webinar. Next slide, please. Thank you. So just a quick note about CHIPO. The Coalition Against Hepatitis for People of African Origin is a community coalition that's co-founded and led by the Hep B Foundation. It's composed of organizations and individuals who are interested in addressing the high rates of hepatitis B infection among African communities around the world. And CHIPO serves as a forum for sharing information and best practices and improving capacity to increase hepatitis B awareness, testing, vaccination, and treatment among highly affected African communities. We currently have over 50 coalition members from across the United States and around Africa. Next slide, please. Thank you. And then a quick note about MAC. The Multicultural AIDS Coalition is located in Boston, and its aim is to mobilize communities of color to end the HIV epidemic. MAC supports broader efforts to eradicate conditions that fuel the epidemic, including substance abuse, sexually transmitted infections, lack of healthcare access, homelessness, and discrimination based on race, sex, ethnicity, sexual orientation, and gender identity. Africans for Improved Access, which is part of MAC, provides HIV and STI prevention, education, and support services to the African immigrant and refugee community in Massachusetts. Next slide. Thank you so much. So to kick off today, we're very excited to hear from Representative Hank Johnson, who will share his thoughts on NAIRHHA Day. And without further ado, we can take a look at his video.
The Coalition Against Hepatitis for People of African Origin for inviting me to give remarks for the official recognition of NAIRHHA Day. This year is the first time NAIRHHA Day will be federally recognized with a resolution that I plan to introduce tomorrow. I'm sorry I couldn't be there with you in person, but as you probably heard, things are a little hectic right now on Capitol Hill. As co-chair of the Congressional Hepatitis Caucus, I appreciate the opportunity to work with community members like you to create a more equitable country. By introducing a resolution in the House of Representatives to designate NAIRHHA Day a federal health observance, I hope to bring much needed national and local attention to the HIV and viral hepatitis needs of African immigrants living in the U.S., addressing those unique issues that African immigrants
Are you able to share your screen too? Sorry.
Awareness, education, and resources. NAIRHHA Day will empower communities to take charge of their health and ensure that this issue will not be
Holly, can you pause the video and share your screen and replay? Folks really want to see the video.
Or I can share it if it's easier.
Yeah, sorry. I'm like having a really hard time doing both at once. Give me 2 seconds. I apologize.
No worries. Thank you. Thanks everyone for introducing yourselves in the chat, and welcome. Do you want me to try to share it?
Yeah, sorry.
Okay, no worries. So give me 1 second. We can also move ahead with a panel discussion, and we can try to share the video at the end as well.
I have it up. I'm ready. Oh, give me permission and I can share. Yeah.
Oh, you can share?
Mm-hmm.
Okay, awesome. Thank you.
Oh, that's not me. Is that me?
Mhm.
Great.
Just you just need to enable your sound. That's the only thing.
Yeah, I'm not sharing. It's telling me I'm not sharing.
Okay, how about we can move on to the panel discussion, and then we can work on figuring out the issues, and we will share shortly. Chioma, do you want to start to have everyone introduce themselves and start the panel discussion?
Absolutely.
Great.
So this is a great year, I'm going to say, for NAIRHHA Day. Let me first introduce myself. My name is Chioma Nnaji. I'm a director at the Multicultural AIDS Coalition, which is located in Boston, Massachusetts. I'm very excited for this day. A lot of us have been working hard for this moment. And so we really want to be able to amplify, uplift, and celebrate this day with all of you all. So thank you for coming. Thank you for being patient. You know, technology doesn't always work with us now that we're in this Zoom life. But thank you for all of your patience. So before I get started, before I ask the panelists to introduce themselves, I do want to take a moment just to say thank you to people who have been working since 2014 in different ways and different capacities to ensure that NAIRHHA Day is here and is successful. These are individuals that sit at government agencies, individuals that sit at advocacy organizations, grassroots advocates. We've had all kinds of folks in this journey to bring NAIRHHA Day to be federally recognized. And I strongly believe that we should give people their flowers while they are here so they can enjoy them. So I want to amplify, uplift Timothy Harrison. He actually was the person, he was at the former Office of HIV/AIDS Policy, right, Amanda? I'm saying Amanda because she's been here since the beginning too. Timothy actually is the first one to give us seed money to actually put together a strategic planning session that gave this as an idea. So there were about 9 of us who came together in a room in Boston and was really thinking about what can we do as an advocacy on an advocacy platform to amplify NAIRHHA Day, to amplify the issues that African immigrants are dealing with. And we came up with NAIRHHA Day in that room. And Timothy Harrison was the one who gave us the seed money to make that happen. So shout outs to him. Shout out to Augusta, Sadie, Amanda, who you'll hear from, Juliet Botima. These are individuals who have been with us since the beginning, advocating in different ways for this day. And then, of course, the team from Hepatitis B Foundation. I think Hepatitis B Foundation signed on to this day early on in the advocacy journey and have been a strong partner since then. And then I also want to give shout out to the folks who have really been coordinating it for the past couple of years, Agatha and Beatrice, who have really been the ones making sure that we're doing what we need to do and putting things in place. So let's take a moment to give them, everybody, just run a round of applause, use your reactions. Let me see your thumbs up in the chat because I really think that, you know, we should celebrate those who are doing the work and take time to say thank you. All right, so now let's get to our panelists. Thank you everybody for being with us for this fire chat. And I always have a unique way in which I bring panelists into the space. I like panelists to introduce themselves with a question. So don't worry, it's not going to be hard. It's not going to require you to share your whole life. So this question, the question I'm going to ask you is, what does NAIRHHA Day mean to you? What does NAIRHHA Day mean to you? And so you have been a part of the work around HIV and hepatitis in your own way. And now, and you all represent the communities that NAIRHHA Day is there to amplify and uplift. And so what does NAIRHHA Day mean to you? And when you answer that question, please share your name and share where you are coming from, whether that's an organization or a city, state, whatever you want to share about that. And I'm gonna hand it over to Amanda first, just because she's my girl. So, so I can get her to go first.
Okay. Thanks, Yoma. Hi, everyone. I'm thrilled to be here. I'm Amanda. I'm the Executive Director of African Services in Harlem, in New York. And I've been with the agency for 23 years. Obviously started as a child, a mere child.
Absolutely, at 5.
And we serve the African immigrant community of New York. We serve approximately 6,000 folks a year through outreach efforts, but with direct services, about 3,500 folks, with legal services, health services, food pantry, English language classes, LGBTQ support and wellness group. Yeah, it's quite the one-stop shop, and I am absolutely thrilled, like I said, to be here, being in those rooms many years ago with Chioma and others that she mentioned. It blows. How do I feel about it? It blows my mind that we're here, Chioma. And I guess what it speaks to me, how it speaks to me. Initially, I just thought, well, obviously the recognition of our community and the impact of HIV and hepatitis B on our communities. And, you know, we're being seen. I mean, being seen is being seen. And now from that, many things can fall. But also, I think it's a wonderful example of the power of the people. Power of the people, man. This was a thought. This was, you know, sitting around. I'm sure there are a couple of beers involved at some point during the day, and you know, this was, you know, something we put together. And when I talk later, I'm gonna take us all the way back to actually 2007 when this seed of an idea began. But yeah, so from there, you know, years, it's anything's possible. I'm so proud of the community, and major props, particularly to Chioma and her team. Yeah, the commitment and success is certainly one to celebrate.
Yes, thank you. Who's next? Who would like to introduce themselves and answer the question, what does NAIRHHA Day mean to you?
I can go next. Hi, everybody. My name is Jean-Jacques. I use he, him pronoun. I am a program manager working on hepatitis B and perinatal hepatitis B program at Public Health Seattle King County. So I live in Seattle. And I am also the founder and executive director of the Congolese Health Board, and also one of the co-founder of the Congolese United Foundation. For me, NAIRHHA Day is 2 things. I would say 3: recognition, gratitude, and fight. And for a long time, it's like we were doing behind the scene work, you know, advocating. Now we get some visibility, and it's time for us to be on the big stage and fight for more. And this is NAIRHHA Day for me, so that remind people, you know, recognize first people who started this battle before us. You know, I've been working in hepatitis B in Africa and US for the last 5 years, but there have been people working in this battle for years before I came to the United States. So we have to recognize those people because they made us to be visible. Now we are on the stage, we need to fight. We need to fight for access to care. We need to fight for equity. We need to fight for recognition, especially for LGBT communities, you know, within African community, and also fight against bias, against structural racism, and also fight against our own tradition beliefs that hold us back for to be able to reach out to our community of immigrants. So we need to fight in different stages. I mean, this is the narrative for me. And thank you for having me for the stage today.
Yeah, you're speaking my language. Yes.
Mhm.
Who would like to go next?
I can go next.
Yes.
My name is Monu, and I'm from Liberia, West Africa, but I'm in Johns Hopkins Master's in Nursing program. I'm in Maryland. So for me, I think my video gonna be played like any minutes from now, so I won't really say much. But for me, I see NAIRHHA Day like as a day of, like, I'm gonna say unity, or not. The association NAIRHHA is like an umbrella of hope, in a sense that whenever you experience discrimination, there's somewhere you can go, and there are people fighting for you, and there's a place of belonging that you can no longer feel like you're alone. So for me, basically, that's how I see it. So I won't really say much because my video gonna say everything that I will say. So I'll leave it as that.
Thank you. All right. Lena, I think you are next.
Yes, so my name is Lena Stinson-Ali, and I'm in Seattle, Washington, and I'm a community health worker. And also I have been working for one of our community health clinic in Washington, Seattle. For me, NAIRHHA Day, it touches on immigrants and refugees specific. I truly commend you for having NAIRHHA Day for us, and bring back a lot of memory coming here as an immigrant and working with so many other immigrants and refugee in the community, and to have recognition on HIV and Hepatitis Awareness Day, to me, is huge, and is somewhere I'll end up by saying it gives me hope, access to care in general.
Thank you. I mean, like I'm so happy to hear sort of you all's insight on the importance of NAIRHHA Day, because you're talking about sort of what that means in terms of how we need to continue to fight and advocate for the needs of African immigrants, what that means also for us as African immigrants. And I'm a second generation. I know I don't have an accent. I'm a second generation of Nigeria, but particularly, you know, what does it mean for first generation Africans to really come together around this day, and what are some of the internal stuff that we need to deal with in order to actually be healthy here and do the work that we need to do here, and then also what does it mean to us individually in terms of being able to access services, and to really access this, what we need in order to be healthy. So I appreciate that sort of very comprehensive understanding of what NAIRHHA Day is, because that's exactly why it was designated and created. So Amanda, I'm going to start ask you to start us off and really just talk about, if you could speak more about the message of NAIRHHA Day, and the intent of NAIRHHA Day, and how you've seen that be a part of some of the work that you've done over the years. Unmute.
Yeah, NAIRHHA Day has been an extremely helpful tool as well in our advocacy to refer to give those the powers that be, the elected officials, the head of health departments, just to to show the organizing that is happening between our communities nationwide, you know, to amplify the needs that we have. We have been struggling for many years at African Services with data, with being able to produce clean data. The large majority of folks that we serve in New York City are undocumented. And without this further stratification of epi data that I think we're all agreed we need to at least identify, at the very least, geographic, you know, regions of origin, can use the same criteria as, for instance, UNAIDS does, but to be able to give both us for our work, but also for the you know, for those that give us the dollars. Oh no, I've lost my train of thought. Oh Lordy, long COVID. I'm so sorry. Yeah.
The significance of the data, disaggregated data.
Yeah, because what, thank you very much. What what happens to us anyway, is we get consumed by the Black African American. And it's extremely hard for us, particularly with an undocumented status, with Medicaid ineligible and all the rest of it, to be able to have that data to show those real numbers. And also at the same time, walk that fine line of not stigmatizing that in, you know, that very fact as well, of many undocumented folks from our communities, you know, living with these illnesses. So I'm not sure how that may have answered the question, but it's been a support and something to be able to refer to, like I said, on, you know, the strength of our numbers, at least in terms of the organizing we're attempting to do.
Yeah, I mean, I think here in Massachusetts, the way NAIRHHA has really been effective, but even sort of the way in which we've amplified it is because, you know, Massachusetts is, just like New York, one of the states that disaggregated data as relates to HIV and reports out, collects and reports, like that's important. But also because it gives us the opportunity to say, okay, what does it mean to actually increase awareness in this population? And is the funding that is needed being directed to organizations that actually directly serve this population, right? And so it wasn't enough for us to hear from the state that, oh yeah, you know, we provide funding to this community health center and this community health center, and they serve African immigrants. No, that's not enough. You know, we want to know exactly sort of how they're serving African immigrants. What do those numbers look like? What do the services look like? Are they culturally and linguistically appropriate? And are they actually successful, right? Like, are they actually successful? And so it allowed us to do that. And then, you know, of course, you know, be able to set up specific programs for the community, like the program that I direct, the Africans for Improved Access program, which recognizes sort of the cultural nuances that we need to take into consideration to properly serve this population, right? So what would you say is happening in Seattle as it relates to African immigrants and the work that needs to happen or is happening, Mr. Kayembe?
Yeah, thank you for the question. I think in Seattle, there's a lot of work we are doing. And I think the most important one is just to set the foundation for this issue in order to be able to tackle. And the foundation for me is to implement culturally sensitive intervention, taking into consideration, like I said earlier, culture's norm, belief, traditions, and also our own bias, because as a physician and public health professional who educate in a colonial system, so I came to public health to bring intervention in with my colonized mindset. So I need to take a step back, rethink how I can implement programs that culturally appropriate to those African communities. You know, I also need to acknowledge that, you know, HIV and hepatitis B are sexual transmitted disease, and sexual transmitted disease are still taboo in many African communities. They don't talk about sex. They don't talk about those diseases. It's the disease of shame. So you need to recognize that, come with that perspective, and try to implement programs and activities that can help those communities thrive and screen more people. You know, we need to increase screening and education and awareness. How can you increase screening if we cannot, like Amanda say, disaggregate those data? Because even King County, I mean, I'm glad now Washington State and other county are working on disaggregating data so we can know exactly by race and ethnicity, what's the prevalence, what's the burden of disease in this different community. But without doing that, putting everybody in a big box of Black people is not helping us. You know, we need to see the trends, but we cannot see the trends within those communities if we label everybody as Black African. You know, now we need to disaggregate to know exactly what's the burden, where can we intervene, and noting that, okay, this particular community, let's say Congolese community, have their belief, cultural norms around hepatitis B, around HIV. What can we do? And the third step will be, for me, improving access and testing. You know, how can you bring testing and solution to this community, not forcing this community to live out where they live, to go like drive 50 miles or 55 or 30 miles to go seek care. You know, I mentioned about coverage, you know, uninsured. How can you make sure those uninsured immigrants and refugees that arrive in the country can get access to healthcare? How can you create material for those communities? And also, finally, you know, data. We cannot advocate if you don't have evidence that there's a burden in those communities. How can you train community leaders, people in the community, to collect data so that we can have those evidence and bring that to the, you know, to our leadership, to policymaker, to the legislator at state level, so to vote budget to kind of support it. That's why I say when NAIRHHA Day, for me, it's recognition and fight, because we are not in a big stage. It's time for us to fight. We can fight only if we have tools. And one of the tools is data. How can you implement passive surveillance in those communities? How can you train those community leaders to collect data? How can you influence those community leaders to work with community clinics so that they can raise awareness? You know, all those different steps are critical for us working on the public health to be able to do more and have those community. And I mean, having this open communication, coming to understand that, okay, we know there's issue, we need to bridge the gap and collaborate, you know, having trust communication needed, then that's required to build this trust and work with community leaders, you know, artists, sportists, all those people, so that we can create a way to foster this collaboration and improve the outreach and the treatment we give to the community.
Yeah, thank you. Amanda, did you want say something? I see you came up.
Just, yeah, thank you so much for that, Jean-Jacques. I agree, absolutely. Yeah, and something you mentioned, like materials, like resources, for those interventions that some of us have been able to do and document, but they're not recognized federally or what have you. Perhaps NAIRHHA Day now can create that receptacle for those, like, you know, like you've done, Chioma, the interventions you've done. They can be, you know, this is somewhere for them to live, where our community from across the country can access. We don't need to reinvent the wheel. We're still building the cart, but we don't need to reinvent the wheel, right? So yeah, they do exist, but we certainly need more. And it's interesting to, you know, since 2020 and everything, I'm sorry, that's my text going off, you know, health equity, racial equity, all the rest of it. And we talk about the need to design our interventions and our programs culturally, linguistically, culturally, you know, to be able to engage community members. And yet, I think another thing that needs to change is, you know, again, like I guess I'm talking federal, state, city funding. You know, it's still these deliverables that you need to follow, and there's not enough wiggle room to be able to tweak the program to that culturally acceptable type of intervention that will garner the results that you ultimately want. And if I can just share a recent example, just on Monday, this is something very small, but I think illustrates it well. We have a health education workshop funded through the New York State Department of Health AIDS Institute. And there's a small amount of money for what they call nutritional snacks, right? So we always do our best to either provide a hot meal or we cook a hot meal. But for this program, it is a small program. So the program director goes and buys sandwiches and makes sandwiches. The contract manager says we are no longer allowed to offer sandwiches. We have to offer nutritional snacks, which to them are like Cliff Bars and grain bars. And so when you're having this cultural equity, health equity, it's like, okay, but if you really want to affect change within our community, you need to listen and be able to adjust. That what you're classifying as nutritional snacks to our community is junk food. Like, it's not something that they would eat. They would eat a sandwich. They'd rather have a hot meal.
It's not even food.
Exactly. So it's these little things. I mean, this isn't going to happen in a day, a week, a month, or a year. But again, I'm so excited that we have this day and this recognition now. And like Jean-Jacques says, from here, the organizing opportunities, I think, are really exciting.
And I want to go into one more thing, and then I'm going to invite Manu and Lena into the space as individuals with lived experience. I'm going to show Manu your video, and then we'll have a deeper conversation before we transition. But, you know, one of the things that I think is very critical to this conversation is the impact of immigration, and particularly the impact of immigration policy. And so I would like to hear you all's thoughts around that. As, you know, when I talk about immigration, often people talk about immigration in terms of when people arrive. I talk about immigration from the point of when someone leaves to whatever is the pathway in which they get here. And then to the point, understanding that as African immigrants are constantly going back and forth between the US and their home country, right? And so I would love to hear you all's thoughts around the impact of immigration policy, and why it's important that we amplify that intersection in order to really address HIV/AIDS and hepatitis B within this population. It's a big question. Y'all got it.
Throw that ball on the field, Trevor.
Somebody catch it. Yeah. It's big because immigration policy is, I mean, it's not friendly.
Immigration policy has been kicking our butts. I have to say, since the Obama years, when our detention numbers were off the charts. So it's been a long time. And I know, again, speaking for African Services, we have folks after Trump did the switcheroo with the first in, first out for asylees. Now we have folks who, well, 100% are going to be approved for their residency, but they've been waiting 8 years or more. Up to 8 years, because they've, been put on they've just gone further. And just, in New York, in the New York, New Jersey area, we have something like 600,000, over a 600,000 person waiting list for immigration interviews. So what this does, the connection that I see with immigration and our work here, that on a Venn diagram, I'd see mental health, depression, anxiety, everything around that unknown, which then leads to possible, behavior changes that then lead to, having to deal with, public health issues. You know what I'm saying?
Absolutely. Absolutely.
I think it's a really important piece to
And I think, also recognizing just, and it's not about undocumented and documented. Like we're talking about statuses that are all in between. We see what's happening with TPS and the way that TPS is sort of, I say that, you're playing around with people's lives, taking people on and off of TPS, because once you're off, you're undocumented, right? That means that you're not going to work the next day. That means that you no longer have health insurance, right? And then, you all this advocacy is happening. Then 6 months down the line, oh, I got TPS again. Now you got to go find a new job. You have, and that leads into, I think, what you're talking about, mental health, that stress and that anxiety, which isn't good for anybody, and especially isn't good for someone who has a compromised immune system, right? Someone
or these kind of stresses can lead someone into that I can't find the phrase, like the behavior which may lead to you acquiring HIV.
Yes. Right. It can open doors for you to make decisions that might not be so healthy for you. Right, exactly. So I want to switch and introduce a video. This is part of Hepatitis B Foundation, does an amazing job on using storytelling to increase awareness and to do advocacy, basically, around hepatitis B. And they do this work with various communities, including African immigrants. And so we are going to show the video that Manu did for Just Be, is the name of the campaign. And then it will be an opportunity for us to amplify the lived experiences of our brothers and sisters and siblings. Because one thing that NAIRHHA Day was centered around was the voices of African immigrants who are living with HIV and African immigrants who are dealing with hepatitis B. So I'm going to share the video.
Throughout my life, I've known myself to be a fighter. When I was 1 year old, I lost my mother, and I was raised by my grandmother during the Civil War. Our home often housed nearly 20 other people seeking refuge. I saw my grandmother as she cared for pregnant women in one of the rooms of the house. She helped them give birth whenever they couldn't reach the hospital. I learned to be strong and independent from her. After I finished high school, I volunteered with a group helping with the Ebola outbreak. Then I wanted to try for the greatest country in the world, so I decided to apply for university in the US. Getting there from Liberia was a challenge, but to cover costs for the journey, my grandmother sold half a land. She was determined to help me. I worked all hours during DoorDash, tutoring assistant at the school front desk to cover my tuition. Graduation brought me a mountain of debt, but I didn't let that to stop me. When I was accepted into a Master's of Nursing program, I went through the health check for admissions. That's when I found out I have hepatitis B. The school tried to rescind my acceptance because of the virus. I started Google searching and I found out that in the United States, there are laws that prevent discrimination in education. I wrote an essay defending my position. My doctor checked my liver health and my viral load was almost non-existent. I called the school every day to check on my application status. Eventually, they relented. And in a few months, I will graduate with my nursing degree. I have always been a fighter, like my grandmother, and I won't let nothing, not even hepatitis B, keep me from my dreams. Just be optimistic.
Wow. So that was very, very powerful. this is the first time I've seen the video, and I purposely didn't want to see it because I wanted to my raw reaction. So first, thank you, Manu, for sharing your story. It's a powerful story, and congratulations on not only getting accepted and fighting, that's the word today, fighting, but also making it all the way through your nursing program. So if you can share with us a little bit more about your story, and particularly what have been your experiences in accessing health services here in the US?
I usually for me, I really don't go to hospital. I'm not gonna lie. The only time I went to hospital was because with Hopkins, it's mandatory as an international student to have a health insurance. Since I came here in 2018, I've not had no health insurance, so I've never gotten sick. And thank God, the only time I ever got problem was I have an asthma, so I was able to like buy a Buterol out of pocket. When I went to the emergency room, I had to pay like $3,000 for like 1 hour in the emergency room. So I usually don't really go to hospital, but I did not really know I had anything about anything I had to do with Hep B. I did not know till I went through this process, and they tried coming for me, and no, I've come too far. You can't come for me like that. I came here as an international student. I brought myself here. The organization that I worked with volunteered like to sponsor me. And when I came here, they're like, oh, the man who was in charge told me he was going to help me. He got fired. So there was no way. I'm like, I'm not going back. I'm going to stay here and finish this school. And then I graduated from undergrad immediately, got into Hopkins, and then they try to give me a problem. But through the health insurance I got through the school that I paid for, I went to the hospital. We did some checkup and everything. The viral load is like almost non-existent. I didn't even know I have it. Maybe one main reason for this for me is the fact that I don't do anything to like affect my liver, like taking any substance and all those things. So probably that could be the reason why. And I exercise frequently. So yeah, but I really don't go to hospital. I'm not gonna lie. Since I went there and they told me it's pretty low, I might go there again. But right now, I haven't been there. I really don't know much about the health system, except when I go for clinical and see other people's problems, stuff like that. Other than that, that's it. And so I spoke with Catherine from the Hep B Foundation that we should go to my home country in Liberia so we can carry out some sort of awareness and stuff like that. And then also like the administration of breath dose to prevent the spread of Hep B. And she said we will go there in December and we see how it goes. So I pray it works out.
I think, I think that's another benefit to sort of being here, being able to get educated and informed about so many of these issues that that our community is dealing with, right? Being able to then sort of take our knowledge and our understanding back home to build that same knowledge and understanding. Because one of the things that definitely I've seen as part of my program and just being in community is how stigma plays out in anything related to if you can get it by sex, right? Like, you know, was previously said, like, we don't talk about sex. We don't talk about anything related to sex. And so if there is transmission of a disease via sex, then it carries so much more stigma. And so I want to bring Lena in the room. And if you could just talk a little bit about your story and particularly, you know, what are the ways in which you've seen HIV stigma personally impact you?
Yeah, so I've been living with HIV/AIDS for over 25 years. And through my journey, it took me 2 years after my diagnosis before I could figure out how to get treatment. And the reason I did not ask for treatment because the fear of my immigration status at that time. And I think we mentioned a little bit about immigration. And to be honest, this fear and this sense of uncertainty still exist in our community today. So for me personally, as a person who's living with HIV, actually AIDS, and who works closely with a community member, I would like to see some policy changes on immigrations. And I think NAIRHHA could be also a tool to push forward policy changes in immigration, because there'll be a voice of the community of immigrants and refugees from Africa. And another thing which I would like also to mention, my own personal experience with stigma surrounding HIV/AIDS. And for me personally, I'm open about my HIV status, and but the way came out actually was one of the person who worked in the healthcare system outed me out. And I think also stigma comes from misinformation in our communities, the fear of rejection among our own community members. And I truly believe, working closely with the community and working in healthcare, some of these stigmas is being perpetuated by the healthcare facilities, because I've seen it in my own eyes where people will be run around and go this way, another way, so that people or clinic specific stated it's for HIV/AIDS. People are not getting their care because those clinics are designated for HIV/AIDS. Some of the clinics have changed some of their names. They call it infectious diseases, something like that. So I think also facilities who care for these people, they also perpetuating stigma. And I also truly believe some of our religious leaders don't want to talk about HIV/AIDS. It doesn't matter what religious leaders, who they are, spiritual leaders, because I know among us, immigrants from Africa and refugees, we have spiritual, we have religious leaders. They still don't want to talk about HIV/AIDS in our communities. And as a result, I feel like working in the community, those who are already affected by the disease, they have fear of being outed out, how people perceive them. And also the fear is among our own community members because lack of awareness and education. And what are services available if I am infected today with HIV/AIDS? So for me personally, the best way to combat these issues on HIV/AIDS and hepatitis, I feel like we really need to work hard. I'll give you an example when it comes to immigration. I have dealt with some international student. One of the requirements when you are international student, you should not be asked for help in the government. So I know in our state, for example, we have a program, it's called EIP. It's early intervention program, but most of the international students, they're not aware of this program exists. And they even they don't know how to navigate the system to be able to get the care they need when they find out that either they have HIV/AIDS or they have hepatitis. It is there. You do not need to be here legally. You do not need to have insurance. But the problem is awareness, education, and how to navigate the system to get the services, especially for newly arrival. It's huge for me personally to be able for them to get the care they need. And then as far as what I do find it in our own communities is that apart from stigma, I would like to see policy changes in immigration. And I think we still have to work together. It doesn't matter where you come from. It could be I'm from Tanzania, Congolese, but we need to work together in order to collect those data and to push advocacy and policy changes in our political arenas. I live in Washington State. There are so many programs for HIV/AIDS, but to this day, not yet to find one for African diaspora in Washington State. So I think we need that unity to combat our issues. It could be stigma, it could be policy changes, it could be immigration, but we need to speak as one voice to make these changes. If we are going to do individually, as where you come from, it's not going to work the way the healthcare system here works. They need the data, they need the numbers, and we need to have clear access care for HIV/AIDS in our state, which we do not have in our communities. If I go right now, in so many communities, if I asked, how do you get an access for HIV/AIDS, probably most of them, they don't know, including prevention, for example, PrEP and all that. I respect people's privacy, but at the same time, awareness and education in how to navigate the services, to me, that will be a key as a person living with HIV.
Thank you very much. I mean, the time has gone by fast. I had a couple of more questions, but I do want to make sure that we show Representative Johnson's video and hear from him. But I want to amplify what I'm hearing from you all, because I think it's important to amplify the strategies that you all are talking about, because this is what it's about, right? Like we have this day, as we've been saying. Now we need to take action, or take more action, because we've been taking action to get this day. Continue to take action and fight. So you all are saying, of course, we need to look at data, disaggregating data. We need to increase education within our communities and ensuring the way that we do that and the interventions that we use are culturally and linguistically appropriate. We need to make sure that language access is a priority, and ensure that African immigrant, the languages that African immigrants speak are a part of that, those initiatives. And then these address discrimination in the healthcare setting. Lena, thank you for bringing that up, and thank you for sharing your experience. I think that, people think because it's the healthcare system that stigma around HIV and hepatitis B cannot exist, but it does. Providers have their own stigma and their own biases around these diseases. And then lastly, which I think is the most powerful one, Lena, that you amplified it, is unity. As African immigrant communities, we need to unify around this and other issues that are impacting. So I want to say thank you, particularly thank you to Manu and Lena for sharing your personal stories, because we know about stigma in our communities, and the only way that we're going to be able to address it, to destigmatize, and ensure that people who have the lived experiences are centered and are upfront in the strategies that we put forth. Thank you to Amanda. Thank you for Jean-Jacques for joining us. Really appreciate your comments. And so now we're going to close our time together with hearing from Representative Hank Johnson.
Thank you, everyone. Thanks, Jill.
Thank you.
Good evening, everyone, and thank you to the Hepatitis B Foundation, the Multicultural AIDS Coalition, and the Coalition Against Hepatitis for People of African Origin for inviting me to give remarks for the official recognition of NAIRHHA Day. This year is the first time NAIRHHA Day will be federally recognized with a resolution that I plan to introduce tomorrow. I'm sorry I couldn't be there with you in person, but as you probably heard, things are a little hectic right now on Capitol Hill. As co-chair of the Congressional Hepatitis Caucus, I appreciate the opportunity to work with community members like you to create a more equitable country. By introducing a resolution in the House of Representatives to designate NAIRHHA Day a federal health observance, I hope to bring much needed national and local attention to the HIV and viral hepatitis needs of African immigrants living in the U.S., addressing some of those unique issues that African immigrants in the U.S. face through awareness, education, and resources. NAIRHHA Day will empower communities to take charge of their health and ensure that this issue will not be overlooked. Thank you all for the work that you do to help eradicate hepatitis and HIV/AIDS, and I look forward to continuing to work with you. Have a great evening, everyone.
So thank you again for everybody for joining us. Please make sure that you connect to NAIRHHA Day on our Facebook page and on our Twitter account. We have in the chat the NAIRHHA Day website. And sing a shout out to Representative Hank Johnson and Representative Barbara Lee, because she also co-signed us to have this resolution. So make sure you tag them and say thank you. Everybody have a great rest of the evening.
Thanks.
Thank you, everybody.
Thanks, everyone. Take care.
Thank you.